United States prison system has been the center of controversy for decades. It's a complicated issue where there's not a one-size-fits-all solution. According to the World Prison Brief, the U.S. incarcerates more people than any other nation in the world, a product of the sudden rise of mass incarceration in the 1980s and 90s. Predictably, overpopulation in the state-run correctional facilities soon became a problem that was quickly answered with the creation of modern private prisons.
These are facilities that house people who have been sentenced by the state, and they're contracted with the State Department of Corrections to run these facilities and basically administer the penalties that have been meted out by the state courts and administered by the Department of Corrections. And there are a lot of reasons why states enter into these agreements with private for-profit companies. The most common reason is that there's a calculation that private for-profit companies can run prisons more cheaply than through the contract than were the state to actually run it themselves.
That's Sharon Dolovich, a professor of law at UCLA School of Law, director of the UCLA Prison Law and Policy Program, and director of the UCLA Law COVID-19 Behind Bars Data Project. She says private prisons aren't the answer to America's incarceration problems.
I think it's a disgusting behavior and one that doesn't actually keep safety. If we have to have a debate about safety, we can look at the last 30 to 40 years and we can see clearly the status quo is crumbling and failing around us.
That's Robert Peters, state senator of the 13th District in Illinois, one of only a few states to outlaw private prisons. He sponsored a 2019 bill that additionally banned private immigration detention centers where illegal immigrants are held in Illinois. Like many critics, he and Dolovich question if private prisons cut corners in order to make a profit. Alexandra Wilkes, the national spokeswoman for the Day One Alliance, says there are guidelines in place to make sure this doesn't happen.
The government is the one that is setting the rules and the expectations down to the calorie count, dietary needs, time outdoors. If you can think of the most smallest detail, it is the government that's setting that standard that contractors have to respond to. They have to meet the requirements of that contract. And something that you have as a result of that at contractor-operated facilities that you don't have at the government-run facilities are a contract compliance monitor. So you have someone who is just there, in addition to all of the other levels of oversight that are going on at these facilities on any given day. You have someone just at that facility alone who is representing the government entity, whether it's state or federal, and they're there solely to monitor how the member company is complying with the contract, again, down to the smallest detail.
The Day One Alliance represents two of the largest private prison companies in America. Wilkes says their goal is to combat misinformation about private prisons and showcase the positive aspects of these facilities. She says private prisons can be a helpful resource, like in 2011 when the U.S. Supreme Court ruled California's overcrowded state-run prisons were unconstitutional.
Contractors were brought in to add relief to that situation, but not just simply another place to go to, but again, with the programs that have proven to be cutting edge, that have proven to be modern, meeting the needs of incarcerated individuals where they are. So contractors, they have more flexibility to partner with different community organizations to bring in some new ideas, some new treatment programs on the rehabilitative side of things. Like I said, those are innovations that might otherwise get lost in a sea of government red tape, whereas a contractor-operated facility has that flexibility to bring in those programs and to offer those kinds of rehabilitative services.
Jack McFarland, Louisiana State Representative for District 13, agrees with Wilkes. He proposed legislation in 2017 to bring Louisiana's total of 2 private prisons up to 9.
My private prison, for an example, was working wonderful. We had workshops, we had educational opportunities, and those are things that seem that work effectively in promoting opportunities for inmates to have skills when they do get out of prison.
Which is an added bonus to the cost savings.
A private prison, when I ran that piece of legislation, it would cost Louisiana, the citizens of Louisiana, $31.95 per day per inmate to house them in Louisiana in a private prison. compared to a state prison that was costing Louisiana nearly $53 per day per inmate to house inmates in state-run facilities. So if you look at it purely from a financial standpoint, that was a over $20 savings per day per inmate. And at that time, we had, I believe, over 20,000 inmates.
Even so, not everyone is convinced private prisons are the answer. A 2016 Justice Department Inspector General's report found that company-run prisons have more safety and security incidents per person than similar public prisons.
We are literally looking at a situation where we are stacking on sentences and stacking them into failing, aging systems, buildings. And yet we have a huge disparity between who gets to have safety and who doesn't. It's just a real problem.
But is the problem with private prisons or with America's incarceration system as a whole? In fact, the National Institute of Corrections reports that private prisons hold only 8% of all the state and federal prison population. As research continues to compare both entities, Dolovich thinks our focus may be in the wrong place.
I think to some extent that fixation on the differences between public and private prisons actually misses a really important point, which is there are no prisons in this country that are even close to constitutionally adequate or morally adequate in terms of the way they treat people, the conditions in which people live. And another way to put it is that public and private prisons are both terrible models as they're currently being practiced. And so I always want to make sure that people recognize that even if it turns out that private prisons are somewhat worse on whatever, metric of humane treatment, use of force, conditions of confinement, so even if we find out that they're somewhat worse and that means that we should be hesitant to go the privatization route, it doesn't mean that the problem is solved.
She says banning private facilities might raise the bar a little, but the root of the problem is still being ignored. Since federal and state governments create the guidelines contracted prisons follow, the problems with private prisons might just be a mirror of the issues in public ones.
Even though it's very true that in the private prison context, there is a financial incentive to underinvest in conditions and treatment for the people who are living inside, that's also true in public prisons because departments of corrections have budgets that they're trying to meet. They're worried about going over budget. Public prisons also are always trying to find ways to reduce costs. And so if we're worried about the connection between a focus on cost savings and the way that a focus on cost savings by prison administrators can lead to prison conditions that are unhealthy and unsafe, then we have the same dynamics in both public and private systems.
The original problem of overcrowding in public prisons is not fixed, so Dolovich says just getting rid of private prisons without addressing any others isn't the answer.
The answer is not to contract out the running of some portion of the prisons or, contract out the custody of a certain number of people being incarcerated, but to take a hard look at all the people that we're incarcerating and identify those people who could be safely released and get them out of prison. I mean, the bottom line is in this country we incarcerate far too many people. There are literally hundreds of thousands of people in American prisons who don't need to be there for public safety reasons, who have already served longer terms than they would have in other Western countries for the same crime and can be said to have paid their debt to society. And so if they've already received some penalty for their crime and they're safe to release, then the burden should be on the state to explain why they're still in custody, is my view.
And Louisiana is already one state that has taken that into consideration. McFarland says politicians recently passed a bill that removes the threat of time in jail or prison for the possession of marijuana.
If you look at the number of people we've incarcerated just based on marijuana, whether you fall or not doesn't matter to me, but if you look at those numbers, we had a tremendous number of inmates that were simply there because they were caught 3 or more times with we call minor possession of marijuana, which was really small amount. And now to reduce those number of inmates, we passed legislation where you get a written citation and you can pay it or show up in court.
A 2016 report by the Brennan Center looked at sentences for 1.46 million people in prison and found that 39% were incarcerated without any public safety reason. That's more than 570,000 people the center believes could have been redirected to penalties like community service. And while Dulovich wants to focus on rethinking the prison system, Peters says we should focus on prevention rather than putting more money into incarceration.
What we don't need to do is continue to build more cages in this country. We have an embarrassing level of incarceration, and I think that, we need to move away from that. We should be leading the world on creating a strong foundation for public safety for everybody, and that when they interact with our systems of safety, that people come out better. And I'm not saying that the way this works is everyone will find one example. You don't build systems down by one example. You build systems around a large group of people. So I would say fundamentally we need to focus on what are we doing that's best for the large group of people so that we can have stronger, better, and safer communities.
A goal that Peters believes can be achieved by creating public safety for all.
We know is that if you focus your energy on giving people a good life, you're going to create more public safety. If you focus your energy on pushing them to the brink, you're going to create public safety for only a few. And so I believe that everybody, no matter their zip code, should have safety. And what we currently have is a status quo that says only a select few actually get to be safe. And those folks tend to be very, very wealthy and very well off. And if we don't actually share safety for everybody, we're not going to actually accomplish the goal of creating true, deep, systemic, short, and long-term safety.
So as the debates between public and private prisons continue on, is any argument actually making a difference? Or should we be taking Dulovich and Peters' advice and focus more on the larger issue at hand?
The real question we have to tackle is, what do we do about the fact that we're running prison systems that are not designed to ensure people's safety and well-being, but actually work predictably in the opposite direction, and that's public as well as private, and what can we do to make them all more humane?
You can find more information about all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
People pine for love, they kill for love, they live for love, and they die for love. It's a very profound system.
Experts say love is a natural addiction. We need to eat, we need to drink, and we need to love.
Then how breast cancer patients are being targeted by the beauty industry.
I would say probably 75% of the patients that I treat who have had these procedures have a worsening of their symptoms.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Even if you're in a company where you're not being experimental, you can bet that one of your competitors is.
The different ways we work post-pandemic. Then,
if we can take control of the cues we send, if we know exactly what to do with our hands and our body and our face and our voice, that's actually a way that we can cultivate an authentic sense of charisma.
Recognizing the small cues that can make a big difference. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.